Hey, Dr. Fink here. Got this great request for a topic to talk about, pans and pandas. Let's get into it. Pandas, I'm going to move myself out of the way here a little bit. Pandas stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep. So basically, it's kids, it's autoimmune. We'll talk about that in a minute. It presents with neuropsychiatric disorder, with neuropsychiatric symptoms, in particular obsessive compulsive disorder or tics, and other associated neurologic symptoms. And it's triggered by a strep infection. The autoimmune response, the antibody response to the strep infection, begins attacking cells in the brain, and that is what triggers pandas. Symptoms of pandas, so they're neuropsychiatric. So the necessary symptoms include either obsessive compulsive disorder, which usually in this case is going to come on somewhat suddenly or very suddenly, and or new onset of tics, motor tics, repetitive movements or sounds. You can have verbal tics as well. It comes on, as I said, acute or subacute, suddenly or sort of suddenly. Waxing and waning course, meaning typically once a child has an episode of pandas, they will be vulnerable every time they have a strep infection, sometimes other reasons, we don't know, but it will come and go. To be a pandas diagnosis has to be 3 years to puberty is the age requirement, and there has to be documentation of a strep infection with the onset of these symptoms or shortly before. There are almost always associated neurologic motor symptoms such as unusual movements, involuntary movements, extraordinary hyperactivity, much more than, say, a kid with ADHD. This is much more than usual, coordination difficulties, and other things. But these are some of the more common neurologic symptoms that go along with pandas. PANS is actually the umbrella term under which pandas lives, but PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. So it's not specific to strep, but let's see. Let's take a look at the notes. So like pandas, or as anything that will be called PANS, or the subsection pandas, obsessive compulsive disorder is a necessary symptom. It is the presenting symptom. However, in PANS, we can also see often an associated extreme restriction of food intake. So that can be seen as part of it. So those are the primary symptoms. You got to have those. Or at least one of them. And then you have a whole slew of other ways that the brain is being affected, and this can present with a range of symptoms: emotional changes, massive dysregulation, again, all of things that are a change from baseline, behavioral changes, changes in speech, sudden regression of learning, new onset or worsening of sensory abnormalities, dramatic sleep changes, urinary problems such as wetting at night or wetting during the day. So you need at least two other things in that ballpark. So the neuropsychiatric diagnosis is in play here for PANS. So this just shows you a little bit of the differences between PANS and pandas. They're both autoimmune disorders, meaning that they're both caused by antibodies attacking cells, and in this particular case, we're talking about cells in the brain. They both have primary symptoms of severe and rather sudden onset of obsessive compulsive disorder, and then other related symptoms. PANDAS is specific to a strep infection, but PANS can come from any infection. We've seen it from COVID. We've also seen it from mycoplasma pneumonia. It can come from any virus, bacterial infection. Anything that triggers an immune response can trigger this autoimmune process called PANS. PANS is still considered pediatric, but there really is no specific age requirement. PANDAS is, seen 3 to puberty. It's specific in the diagnosis. Now, this can lead to, not usually, but it can lead to something called autoimmune encephalitis, in which the immune system attacks the brain in such a way that it becomes acutely inflamed and can cause extraordinary changes in function and damage. That's a medical emergency. The person has to be seen in the emergency room, and they will get all kinds of workup, including a lumbar puncture, brain scans, all the things, because you can't wait on that. Now, certainly most pandas do not become that, but they are still affecting the brain. And they also have this autoimmune feature of many other parts of the body being infected. So joints can be affected, the blood vessels can be affected, and a range of other serious medical complications that can occur. To diagnose it, you have to rule out other things. There's no test that's actually for PANS or PANDAS. There are some things we can look for, but it's what's called a diagnosis of exclusion. You're going to rule out other disorders and other things before you come to the diagnosis of PANS or PANDAS. And finally, thanks for hanging out with me this long. What causes it? Well, I've mentioned it before. There's the infection, and then the immune system gets activated, and the antibodies fight the invader, and they also can mistake certain cells as they think it's an invader, sometimes called, or one version of it is called, molecular mimicry. And these antibodies affect specifically brain cells that can trigger the symptoms of obsessive compulsive disorder or tics, or the severe food restriction we see in PANS, which is closely related. When you see it, it looks obsessive compulsive. These antibodies can affect many other systems in the body, and this can be a very complex, difficult disorder. It can have a chronic course. It can be resolved and not really come back. For PANS, PANDAS almost routinely we see a waxing and waning course. So what it looks like can vary, and the degree to which someone is affected can vary. Anyway, so that's highlights. I didn't talk about treatment. I'll do that separately. There's just a lot to take in here. But let me know what you think and if this is helpful.